Hello, and welcome to another episode of Boundless Body Radio. I'm your host, Casey Ruff, and today we have another amazing guest introduced to you now. Dr. Matthew Bernstein has been a respected clinical psychiatrist for more than 20 years and is one of the leading voices in the emerging field of metabolic psychiatry. After graduating summa cum laude from Columbia University, he received his medical degree from the Perelman School of Medicine at the University of Pennsylvania. Dr. Bernstein then trained at the MGH McLean Psychiatry Residency program, where he served as chief resident. He remained at McLean Hospital after residency as a psychiatrist-in-charge and later served as an assistant medical director of its schizophrenia and bipolar inpatient program. Dr. Bernstein has developed his passion for community-based care as the chief medical officer at Ellenhorn, a sister program of Accord, where he is the founder and CEO, where he has pursued alternative ways, such as focus on metabolism, nutrition, circadian rhythm biology, and exercise, to help individuals achieve their best levels of functioning without relying solely on traditional psychiatric approaches. In addition to serving on the clinical advisory board at Metabolic Mind, Dr. Bernstein is also known for organizing the first ever public conference on metabolic psychiatry in 2023. Dr. Matthew Bernstein, what an absolute honor it is to welcome you to Boundless Body Radio.
Thanks for having me. It's a pleasure to be here, Casey.
It's such a joy to chat with you. I'm so continually surprised by finding pockets of people all over the world that are kind of working on this in different ways. And you just think that if you're in this world of ketogenesis and ketosis and you follow all the people and you listen to all the podcasts, you know about all these people all over the world. And like, it's really amazing to find so many people in their own little neighborhoods all over the world that are coming to similar conclusions about this stuff. It's a really exciting time.
It's extremely exciting. And I think it's growing. I think that's partly why we're finding new people, because we're growing.
Yeah, that's amazing. I do a really stupid thing sometimes where I ask you a question offline, basically, where I wish I would have asked you or been recording during the question because it was so interesting. So I hope you don't mind. I'm going to ask you again. We mentioned in the introduction that you helped organize the very first kind of metabolic psychiatry conference about this stuff last year. Can you tell us a little bit about that experience?
Yeah, sure. Well, I've been in my journey learning about this for a few years and applying it with patients and starting a metabolic psychiatry track at Ellenhorn. And I've always been passionate about education. So whenever, I've had a teaching appointment since I graduated from residency, and I love teaching. And so I'm thinking to myself, this is so powerful. I want all the mental health clinicians, all the psychiatrists to know about this. And luckily, my leaders at Ellenhorn helped me, sponsor this conference where we got to bring in amazing speakers, and we had it live, but we also had people online, and we got to introduce a whole batch of mental health clinicians to this field of metabolic psychiatry and the power of metabolism to improve brain and mental health.
That's amazing. Who were some of the speakers?
So we had Chris Palmer, Georgia Eade, Guido Frank, who's doing incredible research on metabolism, ketogenic diets, and anorexia. Beth Zupek-Kanya, who's been one of the leaders in ketogenic diets for epilepsy for over 25 years. Incredible speaker. We had a lived experience panel where we had 3 people who had incredible recovery stories from their mental health problems through using ketogenic diets. I gave a talk on microbiome and the gut-brain axis and how it pertains to metabolism and mental health. We had Ignacio Quaranta, who's an amazing psychiatrist from Argentina, give a speech, and he was great. He came from Argentina for that. So it was wonderful. We had a lot of clinicians, but we also, interestingly enough, we had a lot of families come who had family members, and people came for themselves to learn about this. So as is typical when you get into this world, I mean, sometimes we speak to the clinicians, but often it's directly to the individuals who want to learn this knowledge. And so we had it as an open conference for everyone. And in addition to the clinicians, we had so many other people there and lots of great question and answers and panels. And it was really great.
That sounds amazing. I mean, the speaker lineup is okay. Chris Palmer, Georgia Eade, not bad. It's whatever, I'm listening to Brain Energy again, as I've been interviewing a lot of people that are involved with metabolic psychiatry, and just the passion in that dude's voice when he's reading his own book is so powerful. He's such a kind dude. Like, I'm so fortunate I've been able to host him and meet him in person. Georgia Eid, same thing. I got to
Yeah.
meet her for the first time at the Symposium for Metabolic Health. And she would just stop people in the hallway and chat them up for like 5-10 minutes. There was a huge line for a book, and she just like talked to everybody. She's so kind and amazing. And Guido Frank, I also got to meet him for the first time. It, where this dude come from, I have no idea, but he is doing awesome work. What a great presentation he made. To get all of those people and a few other people that I was unfamiliar with at your conference sounds amazing. And I think one of the most important things you said is the combination of having the experts in the room, but also having the individuals, the families, the people dealing with this, to hear those real stories and know that there's this whole other world of people that are like really fixing some serious suffering out there must have been super powerful.
I think it was. People, really thought the conference went well. I got a lot of real positive feedback, and everyone keeps asking, when am I going to do the next one? But it took a lot out of me, I can tell you, to put that conference on. And this year I've been working on launching this new program instead called Accord, which we can probably talk about. So I haven't had the energy to put on another conference. So we're going to put on a webinar series next year, and continue the education mission, which is a big part of things. And partly why I like to come on a show like this and talk to you and your audience and really just try to spread the word as much as possible about how powerful this is. And, I'm someone who's got, over 20 years experience working with people with serious mental health issues. And I'm just blown away by how powerful it is. And I just want to tell the world.
That's amazing. Yeah, when people get this passion, they really just can't shut up about it.
Right.
And yeah, I understand that organizing conferences, it takes a tremendous amount of work. So God bless people like Doug Reynolds who are doing the work for us, and we don't have to go out there and do that. We could just do podcasts and stuff like that. I'm fascinated by your programs. I definitely want to hear about those. We'll be talking a lot about that today. I want to go back and hear a little bit more about your story. As you're mentioning, kind of the confluence between the experts in the field, the psychiatrists, but also people with personal stories. It kind of puts you in a very unique place because you've got a little bit of both. I know this hits quite home for you personally as a family, but how did you first get interested in psychiatry as a field to begin with?
So, I mean, that's actually a little bit of a personal story too. My best friend growing up, his older brother had schizophrenia, and we sort of witnessed him, when we were in middle school, just really kind of fall apart in psychosis and alcoholism, and he ended up dying young. It was really tragic. So I sort of always thought to myself, like, wow, that is a serious situation, and something that I wonder if I could ever, help in a situation like that. Fast forward, I'm in, undergrad and studying everything. And yeah, I started as pre-med and decided not to do it. And then I went back and did pre-med classes and went to med school. And I had an idea when I was going to med school that I wanted to be a psychiatrist with sort of that story in mind. And also a distant relative of mine had schizophrenia as well, sort of a great uncle. And I always heard stories about him. He was sort of a musical genius, but was psychotic his whole life. And so I just sort of had this in my mind. I always had a fascination with people with who had psychosis as a thing. As an undergrad, I studied some philosophy. I studied shamanism. Just these types of things really always fascinate me. Psychedelics at the time, I was very fascinated about. And so, I decided that, psychiatry was the place that not only could I, do a lot of good, but it's something that I think would be interesting throughout my whole career and probably would change a lot through my whole career. And here we are now. And I think I was right back, 25 years ago when I made that decision.
Wow, that's awesome. Please don't assume that our listeners have the same level of ignorance that I do. This is a very ignorant question and coming from me. Remind me, I should know this, but remind me what's the difference between psychiatry and psychology?
Oh, yeah, of course. So psychiatry is a branch of medicine. So you go to medical school and then you do a residency, first do a year of internal medicine training after, or what's used to be called an internship, and then 3 years of psychiatry training after medical school. So that's a psychiatry training, and have the ability to prescribe medications. Usually there's psychotherapy training. I was definitely heavily trained in psychotherapy and still practice as a therapist. But there's that combination of being able to do the medical part as well as the therapy part in a psychiatry training. Whereas psychologists are either, they can be PhDs or master's level clinicians, or there's a PsyD degree as well. My wife is actually a PsyD, she's a psychologist. And so they're studying more the psychology, the mind, and psychotherapy. Some PhD psychologists end up doing, neuroscience research, but there's not that medical training quite as much. Yeah.
Got it. Okay. Thanks. I appreciate that.
Yeah.
Okay. So what was it like? What did you assume it was going to be like? And then what was it actually like when you started practicing medicine? Were you making huge leaps and bounds? Were the things that they were teaching you like really helping a lot of people? Like, how did that kind of evolve over the course of your career?
Yeah, great question. So I started my career, I worked on an inpatient unit at McLean Hospital, which is one of these old psychiatric hospitals, started in 1812 in Boston, and then ended up moving to Belmont, Massachusetts. Um, and I worked on an inpatient unit, schizophrenia and bipolar. So it's a big enough hospital where they could actually divide up the units based on diagnoses. So pretty much to be on this unit, one needed to have a psychotic condition. And so it was very intense. We were also teaching residents on that unit, which I loved. I always loved the teaching part. And people would come in. It was, people were in acute distress, hearing voices, often suicidal, or had made a suicide attempt. We were using lots of medication, lots of electroconvulsive therapy or ECT. And we could get people better. I mean, we were saving lives, I would say, pulling people out of these episodes. But after, sometimes a week or sometimes 2 weeks or 4 weeks, we would discharge them. And unfortunately, they would often come back. They would leave the unit, they would take these medications, often antipsychotic medications, and they just decide to stop them. And, I've told this story before, but, it's at the time, how I was trained was to say, oh, this person is non-compliant with their treatment, sort of blame them. Um, and really, in reality, the medications weren't helping them all that much once they got out of their acute episode. They were causing huge metabolic disturbances in people, huge weight gain from these atypical antipsychotics. And now knowing a lot more, I don't blame these folks for stopping these medications. They were making a rational choice. They may have gotten out of their episode, but they weren't getting back to their level of functioning, and they were gaining lots of weight and not feeling healthy, not feeling functional. Why would they keep taking those medications? But at the time, our mantra was sort of blame them and also say that their illness came roaring back when they stopped the medication. We also now know that there's withdrawal symptoms from stopping medications abruptly, and
Right.
it's not just their illness coming back, they were in withdrawal from their antipsychotic medications.
Wow.
So I wish I knew then what I know now,
Sure.
but we can say that, about a lot of things, I think. Yeah.
Yeah, absolutely. So what kind of environment, I know this is very general, but what kind of environment were these people being released back into? I'm guessing that if they're already having a lot of episodes, it's probably not the best situation that they're even going to go back into. Is that correct?
Sometimes, yeah. I mean, it really varied at a hospital like that because it's a private hospital, but we also took, people, kind of all comers who came from an emergency room. So some people were going back to a homeless shelter. Some people were going back to a nice house with their family. But either way, people weren't having great outcomes with these illnesses, with the treatments that we were offering in the long term. Like I said, I think we could save people's lives. We can get them out of their acute episode. But in terms of returning people back to their previous level of functioning, we just weren't able to do that.
Interesting.
That would almost never happen with
Yeah.
those illnesses. Yeah.
With the therapy that you described with the electrical, I can't remember what the acronym was, but can you explain what that is like? I heard things about it, but I don't actually know what it is.
Yeah, I mean, this is quite a controversial topic. I'm happy to talk about it a little bit. So the term is ECT, or electroconvulsive therapy. People think about the movie One Flew Over the Cuckoo's Nest with Jack Nicholson, and at that, the depiction of that is sort of this barbaric treatment. And it's basically, it's been changed. It's become much more modernized with, real anesthesiologists, and someone is put to sleep essentially with anesthesia. There's electrodes put to the side of the head, and a brief current gets passed through the electrodes, which essentially induces a seizure. And the seizure lasts anywhere from 30 seconds to 90 seconds. And it's a very effective treatment for very acute, very serious symptoms. whether it be, severe depression with suicidality, or catatonia, or very severe psychosis or mania. It can be sometimes really life-saving. I've seen it save lives dozens of times. But it is a very serious treatment with lots of, terrible side effects, including memory issues, which happen, which are often temporary. But I've certainly had people under my care who are convinced that the ECT course has caused some permanent loss of distant memories. And,
Interesting.
in the literature, that's a controversial topic, I would say, but I find it believable with some of these folks. I've spent many hours with them talking about the memories that they don't have, from not just recent periods right before their episode, which is common, but even distant memories that they just can't recover, they can't retrieve.
Interesting. Wow.
Um, yeah.
Wow. We'll obviously talk about diet here in a few minutes, but it reminds me of something that our mutual friend Nicole Laurent mentioned on our show. That, like, if you have been treated for some of these diseases, what you have gone through is already very difficult. Changing your diet is not going to be as difficult as whatever it is you've been treated with in the past. I think that's an example of something that, yes, can be very helpful, but also is very challenging and difficult. And changing the diet is not going to be, that hard, I guess. Um, and so I did want to ask you also, what was the story with your own family suffering from mental health issues as well?
Yeah, so around 8 years ago, I have three sons, and two of our sons became very ill almost overnight. It was unbelievable. So, happy, well-adjusted kids. One of them was 12 at the time, and one was 14, and they just, fell apart, literally. And it looked very mental health in the beginning. Lots of obsessions, severe depression, suicidality, totally unable to focus and concentrate. They couldn't go to school. It was, literally, they went from happy, well-adjusted kids to completely being unable to function. And, we tried to get help through initially psychiatry because it seemed very psychiatric, and therapists. They were literally being made worse by the medications, which for me was very hard to see or even accept and believe, given that that was my trade literally was of no use to them. And eventually we figured out that they had a condition called PANS, pediatric autoimmune neuropsychiatric syndrome, or also known as PANDAS, which is due to streptococcus. That's a more common term. Turns out that it can be caused by any kind of, not any infection, but lots of different infections can cause this autoimmune encephalitis, or essentially the immune cells attacking parts of the brain. And this led us into a very deep dive into functional medicine, environmental medicine, all kinds of, treatments that I could not have ever imagined that I would be, authorizing for my kids to do, things that are not considered, standard of care, very alternative in some cases. Some of them were just intense, very medical treatments like IV antibiotics. But we did a gamut of other things, including nutritional interventions. And, it was really, that all those intensive alternative interventions that eventually, had some traction and where they got the most benefit. So, I mean, it's just an unbelievable experience, but incredibly eye-opening for me as a clinician, seeing that the regular standard allopathic treatments that I knew had no benefit for my kids, and really getting that experience of being in the position of, regular medicine's not helping, we have to find something else. And so I really know what that's like. I have so much more empathy for the people that I treat and the families that I work with, since that experience, knowing that, the standard stuff sometimes really doesn't provide a good enough response.
Yeah. Wow. I've been trying to think for a while now what it would be like to be in your shoes and not only seeing your kids suffer, like that's bad enough, but also knowing that what you had learned was not necessarily helping where you thought maybe it could. The combination of those two things must have been utterly hopeless. It must have felt really dark.
It was really tough. Yeah, I mean, my wife and I, were together in this, and we, really circled the wagons and supported each other. But it was some incredibly dark months and years that we went through. Incredibly challenging. We really had to dig super deep, and of course we had really supportive family members as well and friends that helped us out. But it was really it was very intense, incredibly
Yeah.
intense for a number of years there. And interestingly enough, when I was in the midst of that, my wife ended up having to mostly stop working because she was, you know, so involved in making sure the treatment was happening. I had to keep working to try to pay for all these treatments because a lot of it wasn't covered by insurance. And in addition, I had sort of another part-time job, learning all this functional medicine so I could figure out, whether we were going to follow various recommendations that we were getting. And I don't know, your listeners may have this experience, but in functional medicine, there's a lot of focus on root cause, trying to find answers, but there's also so many things that are being offered and so many things to choose from. There's 20 or 30 different tests, whereas the regular doctors are only offering one or two tests. And how do you choose which of these to do and which of these treatments to do, and how aggressive do we want to be, these things. So it really required, in my view, like I had to do a deep dive on all of these things. So it was quite an education at the same time. Yeah.
Wow. When you talked about earlier, having an interest in things like psychedelics and shamanism, do you think that kind of openness to explore other things that may have been a little bit more I don't know if controversial is the right word, but not really so mainstream. Do you think that helped you later on as you were trying to explore some of these new things in functional medicine?
Oh yeah, for sure. I mean, I've always had an open mind. I think, medical training, sort of sort of forces that out of you to some extent. Medical training is incredibly hierarchical, and it's very you have to sort of conform. It's sort of conformist. You are part of this system. You do what the system tells you to do, how you're trained. You get really good training, and it's okay to keep learning, but it's, everything needs to be sort of, evidence-based in a very specific kind of way. And so, I think that sort of open-mindedness was a little bit sort of beaten out of me in medical training, but it was still in there, and I think it did come back out when it was really needed, which is certainly during that time.
Yeah, thank goodness. Well, so of all the things that you're describing, you're right. The field is very broad. So many different things that you can choose from and explore. What were some of the big rocks? What were some of the things that moved the needle the most? Was it diet in particular? Was there some form of treatment? Was it metal exposure? Like, what were some of the things that you really noticed like made a huge difference?
For our kids. Yeah.
Specifically for the kids.
Yeah. So in the end, they both got diagnosed with Lyme and co-infections and ended up on courses of IV antibiotics and oral antibiotics for over a year. That was very important. And during that time, we were with a doctor who was incredibly aggressive about doing everything all at once. So we were doing so many things at the same time. It's a little hard to say which was the things, but I can say some of the things we were doing. The IV antibiotics, she was environmental medicine, so we were doing lots of detoxification with sauna. She was doing IV ozone treatment with them, hyperbaric oxygen treatment, red light therapy. We were eating gluten-free, dairy-free, sugar-free, incredibly clean diet at the time. We had not really discovered ketogenic diets at the time, but we were definitely doing some things on diet. And we were doing some IV nutrients as well. So IV vitamin C, glutathione, alpha lipoic acid, intravenous frequently to sort of boost their nutritional status. I'm probably missing a few things, but those are some of the highlights, and that's a lot.
That's a lot. Yeah, that's a lot. Interesting that you were already changing the diet. It's cool that they recognize that that did play a part.
Yeah.
But when was it that you started to learn about metabolic psychiatry and in particular like ketogenic diets, low carbohydrate diets, and how they work in the brain?
Yeah. So in the midst of all this, probably about 6 years ago, we were in the thick of it with our kids. I was at a grand rounds lecture at McLean Hospital where I trained and worked. I had since left working there, but I still would go back for the education. And Chris Palmer was giving a lecture on ketogenic diets, reversing psychosis. So that was my exposure. And I had known Chris when I was a resident. He was a couple of years ahead of me in the training program, and he was one of these nice guys that we would go and have lunch, and our heads were spinning and not knowing what we were doing, and he would help us out. So he was sort of like someone who I'd known for years and trusted. And so I'm sitting listening to this lecture, and my mind was blown. The stories that he was telling, some of these case reports, and could not believe what he was saying. And he was talking about the science. The science made so much sense. And there was so much of it, which was also fascinating because, when you go to psychiatry education lectures, often the science is not that impressive. In terms of, there's great imaging studies, but in terms of the clinical science, we know about these medications, we know a little bit about what neurotransmitters they work on, but we really don't know all the mechanisms of how these medications truly do what they do to reduce symptoms. And he was talking about all these incredible scientific mechanisms that I've now learned so much more about. But I mean, my mind was absolutely blown, and I would say that if I had known him, I might not have believed some of these case reports that he was telling, because he was talking about people with decades of psychosis and being on the strongest antipsychotic medications, still having symptoms, having all their symptoms literally melt away in a few months on a ketogenic diet. And my guess is that most of the people in the audience were sitting there thinking, oh, that can't be true. Except all those of us who know Chris and know that he's a completely honest, straight shooting person.
Yeah.
Right?
To that point in your career, had you seen that one time, like in your own practice?
Had I seen someone's
in that situation where they had been in psychosis for a very long time and they change, I mean, anything, medication, and all of a sudden they have no symptoms or maybe don't need medications anymore?
I'd never seen someone with years of psychosis not need medication anymore. And I'd seen people switch from maybe a medication that wasn't working to this one clozapine, which is the one he was talking about, this person was on. And sometimes there are symptoms, you would have a miraculous response to clozapine. But clozapine is a really difficult medication to take. It's not first line at all because it has some really significant and dangerous side effects, including side effects where people need to get their blood drawn regularly to check their blood. So occasionally we see that with clozapine, but it's pretty rare and not to the degree that he was describing. And he was talking about someone whose symptoms didn't go away on clozapine that did go away on a ketogenic diet. So this was just, mind blowing, literally.
It would be cool to go back and be you in that conference and actually see some of the light bulbs going on. I think once you've been in this sphere for long enough and you've learned about this stuff and you've heard so many case studies, like it doesn't almost like even phase you or surprise you anymore. But to be near you and you're like, what is going on? This is crazy. Like that would be pretty interesting to see your reaction.
I was fired up for sure.
It didn't sound like it took you very long to be like pretty much on board as well.
Well, yeah, I mean, I was so fired up. I said, all right, I have to investigate this more. Even though all the stuff was still going on with my kids, I put myself on a ketogenic diet and I felt immediately better. I think I was quite insulin resistant at the time. But I wasn't at the point where I could start applying this in my practice just because we still had so much stuff going on with my kids. We still hadn't gotten to that doctor who was doing all those things yet. And I just couldn't devote the resources in myself to start figuring out how I was going to apply this in my practice.
Yeah.
But once my kids started getting better, it was always in my mind. I was like, I need to come back to this. I need to figure out how I'm going to get people in my practice to start doing this. Like this is something, and I knew I needed to come back. I just couldn't quite do it for a couple more years until we were out of the woods a little more with our kids.
Yeah. That makes sense. Was there any trepidation as far as like this isn't like standard of care? Also, did you feel like inadequate talking about nutrition when it came to these things, or did you not really find that to be a terrible burden?
I think I always, in the beginning, I would think to myself, like, well, what are my colleagues going to think of me, talking about a nutritional intervention? I didn't spend too much time with that. I mean, at this point, I'd been through so much, and I've always been just devoted with what is the thing that's going to help my patients the most. So the biggest challenge I felt was, how am I going to convince people to do it? As you said, Nicole's quote is absolutely right. Like people have been through so much that this isn't that hard compared to what people have been through. However, I mean, I think there's a lot more to say about the difficulty of it for people with severe mental health conditions, because it is hard and people have been not just through so much, they've been traumatized. And sometimes when people have been traumatized and someone comes around and says, oh, I've got something that's going to help you, it's hard to even have hope anymore. And so if you don't have the hope, I mean, that's the engine to make the change, right? And so many people who have had these conditions for years and years have been pulled out of their lives. They're afraid to have hope again. And so that's the first step is, first we gotta, you know, sort of find the hope that, and luckily I had a number of people in my practice who had known me for a long time and they trusted me. So I could start off with people who already knew me and already trusted me. And, they were looking at me like a little bit like I had three heads, when I started talking about nutrition, because they'd never heard this from me before. But, they got used to it and we started doing it and we started seeing the amazing results. And
Yeah.
so then we were off to the races.
It's
Yeah.
amazing. Wow. Okay. So let's pretend our audience has never heard of this before. I think you're one of the very best about explaining the difference between these two things. If we say metabolic psychiatry on one side and we say medicine psychiatry on the other side, how are those two things so different? What are pros and cons of kind of each of those things?
Yeah, great question. So we'll start with medicine, traditional psychiatry. We're going to offer people medications based on the diagnosis that they have. Um, there's various classes of medications. So let's say someone has depression. We're going to offer them an antidepressant medication, most likely. We're going to offer them psychotherapy. Um, Ideally, they're going to get a combination maybe of the two, of medicine and psychotherapy. With the medications, there's a little bit of we're going to pick one medication based on a few potential things, but there's a very much of a trial and error part in medication. I think any honest psychiatrist will agree that we try one thing. If it doesn't work, we try something else. People sometimes say, it sort of feels like we're just experimenting. And I have to admit that, yes, to some extent, we try it. We even call them medication trials, when we put someone on a medication. We're going to try it, the antidepressant, we'll give it 4 weeks or 8 weeks, see if someone's improving. If not, we may try a different one that has a slightly different mechanism of action. If that doesn't work, we'll maybe try another one. We have other things to offer these days, such as TMS and even ECT if someone's very acute or severe and they're in a hospital. We've got ketamine to offer. Ketamine-assisted psychotherapy is exciting, and they're working on other psychedelic-assisted psychotherapies. So that's the pro, I think, is that it's a medication, and for some people that they like that, it's like all I have to do each day is remember to take this one pill. It's not that hard, and that's the paradigm in which we all kind of live. So people are used to that too. I go to the doctor, they diagnose a problem, they give me a pill. People are so used to that paradigm, and that's what they expect when they go to a doctor. So, I mean, those are some of the pros. The cons are that it is a little bit trial and error, and it can take a long time to find a medication that's helpful. Even when the medication's helpful, it's very, very rare for a medication to completely resolve someone's illness. We don't see huge effect sizes in these trials of these medications. And in reality, in the real world, we also usually don't see giant effects from medications. Sometimes the combination of medicines and psychotherapy can get people all the way to where they want to go, and that's great when that happens. And then there's side effects of medications, unfortunately. So we've talked about some of them already, but there's tremendous weight gain with some of these medications. There's some neurological side effects with some of the medications. Some of them affect the liver, some affect the kidneys. Depends on the medications, but we can cause some serious harm to people through the prescription of these medications. And I've always been just so worried and conscious of the metabolic disturbances that I've been causing through these prescriptions over the years, and it's real. People gain 20 pounds on an inpatient unit, and they gain 40 or 60 more pounds over the next year sometimes on some of these medications.
Yeah.
It's really tremendous. Yeah.
Wow. The life expectancy kind of numbers around mental health is just so sad how much less years on an average. And then thinking about like an average could be slightly better or way worse depending on the person and what that's causing. Yeah. Okay. It's seems helpful, especially kind of short term, and definitely not trying to like poo poo that kind of system and the medical system and all that stuff. Let's contrast that with metabolic therapy. When we're talking about metabolic therapy, and what are some of the pros and cons? Obviously, a huge con is somebody's going to have to change the way that they're eating. And unfortunately, in this country, we have a lot of food that tastes really good that we probably shouldn't be eating. So, can you tell us a little bit about how metabolic psychiatry works? And again, some of the pros and cons there.
Yeah, so we're going to talk about big, main foundational intervention is diet, and low carb for sure. Get rid of sugar, get rid of ultra processed foods. If I can get people to do it, I want them to do a fully ketogenic diet. Making ketones seems to be incredibly helpful for the brain. And we can talk, there's so many mechanisms that have been, elucidated about that through the epilepsy literature. So, a whole foods approach, making ketones, as you said, there's some work to be done to be able to do that. And it's swimming against the tide in our food culture. And so, that's a big hurdle for some people, but it's incredibly important and incredibly effective. I'm also asking them to do other lifestyle changes as much as they can. So I want them to exercise, even if they're starting with just walking, but I want them to start moving their body and try to progress through an exercise program. I want people to align their circadian rhythms. So I want people getting up earlier in the morning, seeing the sun, not getting blue light at night, seeing the sun throughout the day, getting to bed at a good hour. That's incredibly hard. I mean, that's also swimming against the tide in our culture in many ways. And then usually some kind of mind-body practice is really important as well in terms of improving metabolism and sort of, making this all work better. So I find that, if I can get people to do that, then that's a real bonus as well.
Gotcha.
It's going to be some more lab work. I'm going to test a bunch of things around their metabolism, around their micronutrients, things that a regular psychiatrist would never do and it wouldn't be necessary as part of prescribing a psychiatric medication, but usually is very much part of the metabolic psychiatry that I'm doing. Checking a real thorough lipid panel, insulin resistance, hemoglobin A1Cs, we're checking carnitine levels, iron studies, and more, lots of things. If someone's interested in hearing the full gamut of the things that we test, I'd be happy to share that. So it's much more medical in some ways. We're looking under the hood, so to speak. We're looking at the what's really going on in the cells, in a much different way than we're doing in traditional psychiatry. So in that way, I think it's a real pro. People like that. They want to see, like, well, what does my blood work show? What does that mean in terms of how we're going to change things? Like, it feels actually much more like a doctor-patient kind of relationship in some ways than I'm just talking to you and then I'm just going to give you a prescription, which is the way, sort of traditional psychiatry is done much more.
Yeah. And you mentioned, the hope aspect of things and the empowerment aspect of things. The former way of describing of taking a pill feels to me like I do this one thing and then whatever happens, happens. It's completely out of my control. There's nothing I can do. This is happening to me versus the other way, the latter, metabolically, what you're describing is like, oh, there's something I can do. I can take a step. I can learn about this. I can do it. That's way more empowering and provides a lot more of that hope that you mentioned being so important earlier.
Absolutely. Yeah. I mean, there's so much empowerment in this process because people learn that what they do, their choices will change the way their brain is functioning and the way their body feels, the way their mind feels. And that is an incredibly empowering thing. They have control over their health. They don't, in the end, if I do my job right, they won't need me, if I really, if we really do well. And that patient that Chris talked about who was on clozapine and, went on a ketogenic diet and got off of clozapine, essentially didn't need him anymore. And lived another, 10 years psychosis free and, just, I think occasionally they would check in is what he's told me, but, really in the end, like doesn't need him. And, ultimately that's the best thing that I could hope for is that, even though I love working with my clients and my people, but, if they don't need me anymore, then I've really done my job.
That's amazing. Yeah, it sounds like you found exactly what Chris found, like the delta between the results that you were getting with medicating versus trying, to use some medications judiciously, but also work on metabolism. That gap and delta must have been amazing. Your job satisfaction must have been so much higher to feel like you were actually making some progress with these people. That must have felt amazing.
It does. Yeah. Yeah. I mean, it's hard to tease out because I also just feel so much better myself since I am doing these practices for me. But what I will say is that it really made it possible for me to do so much more. I had to learn a lot to go from being this traditional psychiatrist to doing what I'm doing now. To me, it really required understanding the science, understanding the nutrition, really doing deep dives on all of this, figuring out how to apply it. And I just feel like, well, I've got the energy to do all that now, which is great.
Exactly. Exactly. Oh, that's great. You did mention something earlier, and I didn't want to miss it because it's such a great opportunity to have you on to explain this. You mentioned some of the mechanisms by which ketones in the brain are so helpful. Can you go through just a few of those?
Sure, sure. So yeah, I like to list out, the big ones first. So improving mitochondrial functioning and health. So the mitophagy story, recycling mitochondria, ketones signal the mitochondria to do that, signal cells to start recycling mitochondria. So that's a huge one. And the other huge one is um, this alternative source of fuel idea that when the brain becomes insulin resistant, we can't get glucose into the neurons because it requires insulin. And ketones don't require insulin to get into neurons. So we're providing this bypass of cerebral glucose hypometabolism or brain insulin resistance. So those are like the two pillars, I think. And then beyond that, we also know we're increasing the GABA to glutamate ratio. So GABA and glutamate are two different neurotransmitters. GABA is the calming one and glutamate's a more excitatory one. We increase GABA and we reduce glutamate, and that really helps in many mental health conditions. We're increasing brain-derived neurotrophic factor, which also gets increased by exercise, but ketones themselves will increase BDNF, and that causes neurons to grow and make more connections with each other. We're reducing oxidative stress in the brain. We're reducing neuroinflammation, and we now know that inflammation is a huge part of many mental health conditions. There's actually a few studies showing that anti-inflammatories actually reverse the combination of depression and inflammation. So if someone has an elevated C-reactive protein and they're depressed, they've done randomized trials with anti-inflammatories and they've shown that that reduces depression. But ketones themselves we can make our own anti-inflammatory by eating a ketogenic diet. And then finally, the microbiome gut-brain axis is a huge part of the story in a ketogenic diet as well. We're improving and changing the microbiome in a dramatic way, with improves gut health and then improves brain health. So, I mean, we could keep going, but I mean, the thing about this is so cool is that because this has been in the epilepsy world for so long, for over 100 years, the neuroscientists have been studying ketones in the brain for decades and trying to figure out exactly how they're improving brain health. So we have a deep and wide neuroscience basis to this treatment, in some ways way deeper and wider than we have in the psychopharmacology world.
Wow, that's amazing. I hope anybody who hears keto and thinks it's some kind of fad will re-listen to that part of you explaining all the amazing things that ketones can do just simply in the brain. We didn't even hardly talk about all the other things it does metabolically all over the body.
That's right.
That's amazing. Okay, so we mentioned a few programs in the introduction,
Yeah.
Ellenhorn being one, and also Accord. And I see kind of some differences here where Ellenhorn already existed when you
Yeah.
started learning this kind of thing. So you would have had to kind of integrate somehow some of this stuff in, which seems to be a challenge, where Accord was something that you created from the ground up to already kind of include this. I hope I got those two things right. But I want to start with the first one with Ellenhorn. What was it like to be learning this stuff and then figure out ways to kind of implement that into a system that was already kind of created?
Yeah, so Ellenhorn it's a psychosocial rehabilitation program. So we basically have these very robust teams of clinicians that work with individuals in the community. It's based on this model called PACT, or Program in Assertive Community Treatment, and it's designed to keep people out of the hospital, in their lives, functioning as independently as possible. And this program's been around for almost 20 years now, very successful. There's a branch in Boston, New York, and LA. I've been working at Ellenhorn for about 14 years and have been the chief medical officer for a number of years. But you're right in that we're trying to insert a different paradigm into a company and a system and a culture that sort of already exists and already has its own culture. And so we've had some success doing that. Some of the clients at Ellenhorn have done a metabolic psychiatry track, and we usually hook them up with some expert dietitians. We've typically used Denise Potter's group called Advanced Ketogenic Therapies, and then the team can help support people in changing their diet. And we've had some great success with a number of clients at Ellenhorn, but there are many clients at Ellenhorn who are not here for metabolic psychiatry. They're not interested in it, and it's not sort of the main thrust of what we do.
Are
So
all of, oh, I'm sorry, go ahead.
no, no, you go ahead. Yeah.
Well, it's so are all of the clients aware of metabolic psychiatry? Like, do they know about it and just don't choose to do it? Or is it's just simply not the focus of Ellenhorn?
It's not as, I mean, we've gotten our psychiatrists trained in it, and we've gotten a lot of our clinicians, our therapists trained in it. But it's not the first thing that we're thinking about, and it's not the first thing that's being offered. If someone is really interested in coming in, we'll flag that, and I'll make sure it's being offered in a very robust way. And over time, some people, even though they've been in Ellenhorn for a few months, they say, "Oh, well, now I'm interested in it. I'm interested in this," and we'll get it going at that point. So it's some percentage of the people, but not most of them.
Got it.
We have a lot of other sort of techniques that we're using that are cutting edge as well in the sort of psychotherapy realm. So they're here for this robust team. They're here for this holistic approach, and this is just one of the things that we're offering within that whole milieu. And so the idea came to open up a dedicated metabolic psychiatry program, and we opened up a cord just in the summer, this past summer in July. It took us, basically we started working on it furiously in around January, and it took us about 7 months to get it launched. We did a renovation of a house, made this big teaching kitchen. So we knocked down a wall, and there's this big, beautiful room with a big island, with the idea that one of the things that we want people to do, they're going to get immersed in this. And one of the things we want to immerse people in is the cooking. And we have a wonderful chef who's been on a ketogenic diet herself for over 5 years. So she really knows the ins and outs of how to make it delicious. And she's a great teacher. And so she's teaching people how to cook. We've got a dietitian who's crafting the meal plans for everyone, and they're getting their macros just right. I'm there doing the psychiatry part of it. We have a wonderful program director who's organizing all of this and doing a therapy component to it. We've got a personal trainer who's taking people out, and we're doing tons of measurements and assessments the whole time. And we're just immersing people in all of the aspects of metabolic psychiatry kind of all at once. It's like, it's like a huge jumpstart for what we hope will be the rest of their lives. That's the goal.
Wow, that's amazing. So for somebody who doesn't know, what kinds of foods are you preparing in the kitchen, and are they tasty? Do people like them? Like what kinds of recipes are you guys making?
So we're making amazingly tasty food. I mean, literally, whenever I have a chance to eat there, I jump at the opportunity. So we generally are focused on more of like an omnivore kind of plan for most people. So lots of delicious and high quality animal proteins. So there might be I had lunch there today, so I can tell you. So we had like a chicken burger with caramelized onions and avocado and this delicious mayo, like homemade mayonnaise, like made from scratch,
Oh my goodness.
and a pickle. It was just like delicious, and some broccoli sprouts on the side, So we really try to do a combination of really high quality protein, healthy fats, and we try to get some plant material in there for fiber and polyphenols for people who tolerate it. We haven't had anyone who's a carnivore come yet, but I mean, we could certainly do that if someone wanted it or needed it. If someone really had a lot of autoimmune or gut issues, it's certainly a pivot that we could do. We just haven't done it yet.
Yeah, sure. Oh, that sounds amazing and very delicious for sure.
Yeah.
Eh, okay, so you've got Nicole kind of saying like, okay, what you've done is already very difficult. Changing your diet is not as difficult as doing the other things that you've already done. And I think she's kind of balanced out a little bit by Chris Palmer, who will say like, look, this is very challenging. Not everybody can get this done. And I kind of see maybe like somewhere in the middle. I think the the reward you get from changing the diet can really drive that kind of behavior and keep somebody a lot more motivated. But where would you say you are on that kind of spectrum as far as the people that come through either Ellenhorn or Accord? Like, do you notice that the compliance is really high, not quite as high? Again, in Ellenhorn, it's not the main focus, so maybe some people are aware of it and some people are not. But have you noticed it's very challenging for people to do this on their own?
It is really hard at first. I mean, so I'm sort of fall down in the middle in that I agree with Chris. Like to get it started, it's hard for a lot of the folks that I'm working with. But once they're doing it, it's usually, becomes much, much easier. And that's true for almost anyone. But I think it's sort of, it's all sort of exacerbated and accentuated by someone who's, suffering from a lot of symptoms, also, has had all these psychosocial traumas, as I said, lost hope, so even just the idea of I'm going to do all these things and maybe I'm going to feel better, like they just can't wrap their mind around it. So the hardest part is at the beginning, is really getting that hope started and making those changes. And that's the reason why when I thought about like, well, what kind of program do we need? I really felt that this immersive residential kind of program made the most sense for people, because there are a lot of people out there who can do this on their own. And there are wonderful clinicians and dietitians who have online programs who can coach people through how to do it. I know you had Erin Bellamy on the podcast, and there's Nicole, and there's Denise's group. So there's wonderful resources out there for people who want to work with someone online and do it at home. But what I see is that there are a lot of people who that's too big of a lift for them, at least in the beginning. And this kind of program where they can come in and someone's making them delicious food, and someone's crafting their macros, and someone's walking them through their exercise program and getting them up in the morning and seeing the sun and doing meditations with them, that'll help them, when they have no hope, say, okay, like I can do all that. If you help me, I'll do it. And then they start feeling better, and then they start getting fired up to, all right, now I want to learn. And we have a huge educational component as part of this. Why it works, how it works. I talk about those mechanisms of how ketones improve the brain and all kinds of other science, and our dietitians teaching them about how to eat, and our chefs teaching them how to cook, and our trainers teaching them how to exercise. And, so they leave with all this knowledge and hopefully the ability to just keep this going forever. That's the goal. Yeah.
I'm so glad you have both of those components. We miss that so many times. There's how to eat and there's how to cook. And I can teach somebody how to eat, but so many people being brought up these days, they don't know how to chop an onion. They don't know how to use very basic. They don't know what a braise is. Like there's some very simple cooking things that people need. And yes, if you've got discipline and a weekend and a smartphone, you can probably learn a lot on YouTube if you just dedicated yourself to be able to do that. But there's also that hands-on aspect. And it's cool that you've got both of those components. It's like, yes, we'll serve you the meals, but here's how you make the meals. And kind of demystifying that part of thing must be very, very helpful.
It really is. I mean, I think that it's one of the reasons why people quit is that they're not cooking and they can't cook. And they're just kind of stuck eating, 3 different meals over and over again, essentially. And that's hard on anyone. I mean, we need a little variety. We need good flavor. We need, things that, food is so powerful. It's such a powerful connection to our psychology. And it really hits us, in our hearts, in our stomachs, it's really key. And if someone's stuck eating food that they really don't like time and time again, and they can't cook something better that they want to eat more, that's going to be a challenge to keep it going, right?
Yeah. Totally. You think about the guy driving home at 6 p.m., sitting in traffic, and he's hungry and his feet hurt. And what do you think he's going to do? Do you think he's going to go home and make the steak and have the salad and prepare all this stuff himself? That seems like a huge barrier to entry. Or do you think he's going to grab a pizza on the way home and continue feeling horribly? You know what I mean? Like, so demystifying that for people and making things simple, I think, is so underrated. You have mentioned exercise a few times as it pertains in particular to mental health. Do you have a preferred modality or like a protocol or something you prefer people to do for mental health when it comes to exercise?
Yeah, I do. I want to see people do some amount of strength training in addition to some cardiovascular training. There's a lot of evidence to show that strength training in particular is good for the brain. We know it's really good for metabolism. Muscles are one of our most important organs of metabolism, and we can talk about all the science about that, and that's part of what I talk about at Accord. But we want people to start building some muscle while in the program. And then, cardiovascularly, also important. We have people walking, we have people, doing some running. And if people are up for it, and once they're able, I love people starting to do some high intensity interval and even super high intensity interval. When I started getting into this, that's what I started doing, sprint interval training. I don't know how much you know about that, but it's like, like the 15-second maximum, effort running. And I got a huge boost from that. And I know the power of that for hormones, and especially for people who are, getting a little up there in years like me. Like that was mind-blowing how much that boosted my progress, I would say. So yeah, so I mean, I think, we meet people where they are in terms of what they can do now, but the goal would be to get people doing some amount of strength training, some amount of cardio, and then eventually doing some amount of high intensity stuff.
Yeah, great answer. I love that. Yeah, move any way that you can, but if you're going to, strength training would be very, very high up on the priority list. And we commonly hear, different excuses, valid or not, that from people when it comes to strength training. Like, I don't go to the gym. I don't want to go to the gym. I don't have access to machines or heavy weights. Maybe I don't have time to do this. What have you seen as far as being able to break through some of those barriers? How simple does somebody need to make it to be able to get really good results when it comes to strength training?
You can make it very simple. I mean, there are a lot of strength, resistance programs where don't need to go to a gym at all. Just start with air squats, as many as you can do, right? And do some deadlift, stuff, with, leave some small dumbbells or just buy a couple of bands. I mean, literally for, $50 in bands, you can start doing some strength training at home and watching some YouTube videos. So, I mean, I understand why people are reluctant. They don't know how to do it. Sometimes they need to be walked through. They need a trainer. They need someone who's going to show them, or at least someone who's going to support them. And sometimes I'm that person. And I've believed in exercise even before I got into metabolic psychiatry. I've been talking about exercise in my practice for years. There's so much data on exercise and mental health, but now I feel like sometimes I spend all day talking about exercise and nutrition, which I love. Yeah.
That's great. Well, as a personal trainer, I'm using this opportunity to make a commercial for personal training and
Yeah.
just say, man, you don't have to hire trainers forever. I've got clients I've trained for 15 years and we see each other 2 or 3 times a week. Then that's great. But I also have people that will hire us for a 30-minute session. I'll teach them a few simple lifts using very inexpensive bands that you
Right.
can buy on Amazon, and people can get great results and they don't need to continue to hire me. But also, I'm just curious. I love asking this question. As you've observed having a personal trainer there, have you also noticed that you mentioned support when you said personal training? Have you also noticed like the bonding that people have with their trainer that goes well beyond, do this exercise to 12, like how that level of support kind of develops trainer to kind of client relationship?
Absolutely. It's a really important relationship. And, we were so lucky because as we were starting the program, there's someone local here who actually sought us out. And he is a personal trainer, but he also is very open that he's had issues with anxiety and depression. And exercise got him out of his mental health struggles. And his passion, his like mission in life is to get people with mental health struggles exercising. And he sees that as his like sort of skill set, like that's his superpower, and he's really good at it. And so he's so we're just very lucky to have that. And almost everyone just really bonds with him, and wants to go to their training. And it's these are people coming in saying like, I haven't trained in years, I haven't been to a gym in 20 years, and they're out there going to all their sessions with him and loving it.
That's
So
amazing.
it's really great. Yeah.
Yeah. Next time my clients complain about me not counting to 12 accurately, I'm going to play this clip back for them and say, see, I do other things too. I've got some stories and jokes and whatever. It's not just the counting. Yeah, I think that's wonderful. It's something that I noticed with our people, how quickly they become family and how we would do anything for them. We talk about them, we worry about them, we laugh with them, we cry with them. Like there's a real kind of bond that develops there. So I think that's a great part of what you're integrating. What do you find your vision of the future to be with Accord?
So that's a great question. We're still trying to figure out. I mean, I think, in general, metabolic psychiatry is so new and there's so little out there that's being offered. And there's so many more people who want it than there are offerings right now. And I think the goal is to try to figure out how do we get this to more people, which means more programs in different places, or online programs that really can do what someone needs when they need a lot of support. Which means, they need a clinician, and there's issues around clinicians having licenses in different states, and there's all kinds of things. So, it's a little unclear to me exactly where we're going. Some of the ideas that we're throwing around are, turning this into more of like a day program. And some people do Accord as a day program, so they'll live nearby and they'll just come in for the day. But we could open up, day programs that are bigger potentially at a much lower price point potentially. So that's one way to go. We're not sure though, or just more of the similar kind of programs in different areas, or more of like an online kind of program. But in my view, I would like it to be sort of a clinical program with a psychiatrist involved, because I feel like that's partly what's missing in a lot of um, the teams that people are creating for themselves. They may have a really great dietitian or nutritionist and a trainer and a coach and maybe a therapist who's on board, but they don't have the psychiatrist on board. And that's really a piece that's missing, unfortunately, that I'd like to try to figure out how to bridge that gap for people.
That would be so valuable for sure. I think that all of that is needed. I'm sure you've had the same experience with the conferences that you've attended and the one that you hosted, where you're in this room, you're with people that understand and they get it. And you get this feeling of like, oh my goodness, a groundswell. Everybody knows about this. And
Yeah.
then you leave, you go to the airport and you take a look around and you go, oh my God, we've got so much more to do and much more work to get out there. And so many people are suffering. It's amazing that we get these individual studies and we go and listen to these presentations and realize like, dang, that was a case study of like 3 people.
Right.
There's millions of people that need to know this. And so I just think your work is amazing. I just hope you have endless amounts of success with it because it's very much needed.
Yeah, absolutely. And I think especially in the psychiatry realm, it's going to take more research, that, my colleagues are in this paradigm of, show me a randomized controlled trial. Until you show me a randomized controlled trial, I'm not listening. And I think that's really unfortunate because I think we're missing a lot there. I mean, some things make sense. Of course, I'm not saying randomized controlled trials aren't important, but that's not the only way to get evidence in the world. And I think in medicine, we've kind of gotten these blinders on that only randomized controlled trials are the only form of evidence we care about. And we're missing a big part of what's going on in the world. I mean, I learned that lesson with my kids. There was no randomized controlled trial about any treatment that we did. And yet those are the things that helped. And so, I'm lucky that I had that. I'm not lucky I had that experience, but like in terms of my career wise, like that's helpful to have had that experience, knowing that that's not the only form of evidence. But luckily, there are randomized controlled trials going on right now. And in the next, 2 to 4 years, those are going to be published. And many of them have a basic science component with the clinical randomized controlled trial. So we're going to be seeing incredible papers coming out, randomized controlled trials, neuroimaging, genomics, proteomics, metabolomics, all showing what's going on here. And you and I know that the results are going to be good. Of course, a skeptic out there saying, well, show me the results. But I feel very confident we're going to have some really interesting results to be looking at in the next few years.
Yeah, such a good point. I'm looking forward to that as well. But you're right. Like, especially when it came to your kids, you're not going to sit around and wait. And
Right.
this is something anybody could try. And there's all these other benefits, if nothing else, to have your level of energy to do the work that you do, is really wonderful. And people can start today. So getting that message out is wonderful. Dr. Bernstein, this has been an amazing conversation. I've really enjoyed this. I'm so glad our paths crossed and we were able to have this conversation. Where would you like people to go to find you and connect with you and your work?
So a couple of places. The Accord website, accordmh.com is great. People can find me personally on LinkedIn, and I'd be happy to connect with any one of your listeners on LinkedIn. I don't use a lot of social media. I'm sort of that age where I sort of social media passed me by a little bit, but I am on LinkedIn now, so people can find me there. And I'd love to connect. And yeah, I just appreciate anyone who's listened and is listening to this message. I think you do a great job on your podcast. I've been listening to them a lot in the last few weeks, and I know that you're gonna have a lot of mental health coming out in the next month or two. So I really appreciate that because the word needs to get out, and people don't need to wait. That's the important message, is that maybe their doctors are waiting, but find resources, find supports, find people out there who can help you do this. Don't do it alone, but this is something that I don't think people should have to wait for.
Yeah, I couldn't agree more. Thank you very much for the kind words. And yeah, we're just so lucky that you're out there doing it as well. Social media might not be your thing, but you told me offline that one of the podcast interviews you did required something on Twitter that I don't know how to do myself, but your son was able to help you fix it. So you'll be able to manage. I think it's great you're getting out there and
I'll
getting
figure
conveying
it out.
information to people. Yeah, it's awesome. Dr. Bernstein, again, thank you so very much for all of the work you do. Thank you for providing hope for people out there and finding new ways and exciting ways of getting this out there and getting it to actually help people. So thank you so very much for everything you do. Thank you for being on our show today. We really appreciate you.
My pleasure. Thank you.
Absolutely. And this has been another episode of Boundless Body Radio.